And the flu hospitalization rate is now at its highest level in over 10 years for this time of year. New data from the CDC shows 53,000 flu-related hospitalizations and nearly 3,000 flu-related deaths since the beginning of October. ABC News medical contributor Dr. Alok Patel is here with more on that. Dr. Patel, good morning to you. What do you make of these new numbers and the age groups affected?
Well, good morning, Diane. What we make of these numbers is that this is turning out to be a very bad flu season. As you just mentioned, the hospitalization rate for this time of season is the worst it's been in about 10 years. And Diane, you mentioned 3,000 deaths. The typical flu season, we could potentially see 40 to 60,000 deaths. What I make of this is that it's still early. We still have a ways to go, and people need to do what they can to stay protected at this time. Last year, only 2 states we're reporting very high levels of flu cases. Right now, we have 16 reporting that status.
So how do you put this in perspective? Should we be in panic mode and alert mode, or is this just sort of something to keep an eye on and be aware of? What do we do with this information?
I'm going to thread the needle and go right in the middle there, Dan. You know me, I'm not really a panic mode type of communicator, but I think people need to be aware of the fact that influenza is just not like any other cold you don't need to worry about. I often hear people say, hey, I got the flu once and I was fine. I'm not worried. That is like saying I once drove without a seatbelt and I survived. It's not a big deal. You need to do what you can because every flu season could be different. If you pass on the flu to a loved one, someone who's high risk, such as a child under the age of 5 or someone above the age of 65, it could be really bad for them. I think aside from hand washing, wearing a mask if you're symptomatic, making sure you get your flu vaccine, one thing we need to normalize and praise this holiday season is people who stay home and avoid social gatherings if they have cold or flu symptoms. Those people are heroes.
Now, you said every flu season varies. So does the flu shot effectiveness, because the strains of flu can be different, and same for in the vaccine. So can you explain how that works and how this year's shot is working out so far?
I would love to, because a lot of people have questions about this. So every single year, there are over 150 sites across the globe that do global influenza surveillance, and they basically put together what is likely to be the flu strain that year and get a shot that is targeted for that. This year, the flu virus, the strains that are being looked at, is very similar to the actual flu shot. So scientists are predicting that the flu shot this year is going to be very effective. Historically, people see those numbers, about 40 to 60% effective, and they say, hey, the flu shot doesn't work. That's not true. That's 40 to 60% effective at preventing a mild infection, but way higher than that, upwards of 75% at preventing severe illness. So in other words, you are more likely to stay out of the hospital if you get the flu vaccine. And if you do get influenza after getting the shot, you are much more likely to have a mild illness. So anyone above the age of 6 months who hasn't already needs to go out and get the flu shot.
So just because you get the flu after getting the vaccine doesn't mean the vaccine didn't work.
Absolutely. It is a protective measure against severe illness, which is what we need right now, given what this flu season is looking to be like and how crowded hospitals are.
All right. Good advice, Dr. Patel. Always great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.